On a visit to the doctor or the dentist, you can now leave that mask at home.
Starting today, masking up is no longer required in places like healthcare settings, long-term care facilities, and adult correctional facilities in Washington. Our Destiny Richards is in the studio now with what the end of the mask order means for our region.
The Spokane Regional Health District supports the State Secretary of Health's decision, saying we should expect COVID-19 guidance to evolve as the virus does. And because COVID transmission is low and cases have dropped for other respiratory illnesses like the flu and RSV, Spokane Health Officer Dr. Francisco Velazquez says it makes sense to end the mask requirement. This also means local health providers can now make their own decisions about masking protocol. Providence released its updated policies just last week that will take effect today.
They take care of a lot of patients that are at higher risk because of either disease or treatment. They also have large volumes of patients, so it is important for us to also protect our providers because healthcare capacity has been and continues to be one of the concerns.
And here's a look at Providence's new policies for its hospitals and clinics. For Providence hospitals, masking is still highly recommended in a patient's room during interactions with caregivers and waiting areas. And you're asked to not come to the hospital as a visitor if you're showing symptoms of COVID-19 or other respiratory illnesses. For Providence clinics, masking is recommended for patients and visitors, but required if the patient is showing symptoms of COVID-19, other respiratory illnesses, or after 10 days of testing positive for COVID. And Providence says it may bring back required masking at its facilities if high levels of respiratory viruses are detected in the community. For more information about the new masking update, you can see this story on KXLY.com. In studio, I'm Destiny Richards, 4 News Now.